One of the interesting concepts of is why do we feel sick? It's important to realize that you are not alone in this world. Although sometimes we look for other people's illnesses to make us feel better, it's really not wishing them ill. It's literally understanding that we are impermanent beings and we all suffer. Now, this is a Buddhist concept, which I find fascinating. I do not consider myself a Buddhist. I'm not looking for a religion, but as a philosophy, Buddhism is very, very pragmatic and practical, as is metaphysics. Now, that may also sound contradictory because people hear the word philosophy, metaphysics, they tune out. Oh, that's woo-woo. Forget it. I'm here on the planet Earth, and why don't you come down also? But it really turns out that what you believe becomes your way of living. It really affects everything you do, including your concept of healing. So what I was saying is what we believe becomes what we are. And it's not something that we should easily ignore. The Buddhist concept of suffering, we all suffer. Humans suffer, we are impermanent. Once you accept that, you can move past it. When you don't accept something, when you repress it, for instance, we live in a culture that doesn't want to embrace emotions. We don't want to embrace tragedy. We either ignore it or we become numb to it. That's not a good way to handle it, and it usually, ultimately, makes us sick. So recognizing we are imperfect beings, recognizing our physical bodies are imperfect and impermanent, we will all die. It's important to accept that and move forward and not pretend that it's not the natural way of existing. So look for these concepts, look for these metaphors that seem to resonate with you. Kabbalah, as I said, again, Kabbalah tells us that the world is imperfect, that literally the universe was created with a flaw, and that flaw is there for us so that we can help perfect the universe. The concept of tikkun means to heal. And we are here in this physical world literally representing higher spiritual reality. This is the lowest of four worlds according to Kabbalah. This is the world of action, known as Asiya, and here man has control. And we are here to be godlike in our actions. And literally, if we do this, we will not only heal ourselves, but also heal each other. So the concept of life is imperfect, it's not supposed to be perfect. If you understand that, then you can deal with it, and you don't become afraid. Again, fear. Fear, I find, is the primal human emotion that underlies a lot of our distress, a lot of our discomfort, a lot of our feeling sick. Fear can be overcome also once we acknowledge that it's usually the fear of fear that creates a vicious cycle in all of us. How are we doing? Any questions? I'll take some questions now and I'll go back.
Could you talk a little bit about what complaining does to people? Is it good that they get it off their chest, or are they creating more of the same negativity?
Good question. I think that we do elicit complaints from people. As a physician, I do that, and as a metaphysician, we need to know where people are suffering, how it manifests in their body. Not to move off the subject, but a lot of emotional issues will manifest as physical. So we need to address the physical and then move to the whole picture. So if we use complaining as a way of communicating, that's great. But when complaining becomes a way of life, it's something which, and if somebody identifies themselves as someone who is sick, I'm always sick, I don't feel well, you literally will probably push people away, because ultimately everyone has their own issues and are not looking for more negative energy. We could talk a little bit about how to deal with the feeling of sickness. And as someone who's trained traditional medicine, I firmly believe that traditional medicine can help people. I know I have my issues with organized medicine and with drug companies and HMOs, but if we really can get past all that, which isn't easy, by the way, the advancements in medical technology cannot be at all diminished. And if anyone wants a graphic example of that, just go into an old cemetery and observe the age of mortality that people used to die. And you will notice a tremendous number of children, young people, young women, particularly in childbirth, who don't die anymore. And the elderly population is now expanding, and most of them are being kept alive by artificial technology, pacemakers and artificial hips and joints, and that's fine. I am someone who feels that the human mind, human technology is natural. I don't think of that as unnatural. Why? It's a product of the human mind. So therefore, it comes from us who are of this planet. Don't deny that. I'm afraid that there are people out there that will automatically reject traditional science and just say, I must go into the world of alternative therapies. I don't consider myself an alternative practitioner. I do consider myself holistic, and by that I take into account those aspects of what we are. But I also consider myself to be an open-minded skeptic. I've used that term often. So I am open, but I am skeptical. And I want to tell you that I apply that to science as well. Throughout my career, I've seen many times where there will be an article, scientifically controlled study, which will come to a conclusion which differs from my own experience. And I'm very wary about leaping onto the conclusions from that one study. And more times than not, eventually it'll be proven to not really be valid anyway. So I'm open, I listen, but I tell my patients when an article comes out that Nexium or Prevacid causes osteoporosis, and everybody leaps at me and says, I have to stop my drug, I'll say, okay, wait a second. Let's wait. It may be true, and I'm not dismissing the possibility, but science needs to be held accountable for its own statements and its own conclusions. As I said, I have other examples throughout my career where science has proven not to be valid, and I have trusted my own judgment, my own experience. Going back to the days when I was a resident in an academic setting, the professor types would say, I don't want to have an anecdotal example, meaning an anecdote, a personal experience. We need to have our studies, scientific studies. And they would kind of laugh at the local practitioner who would say, well, I had a patient with this and this is what happened. Having been in practice, I find that even one person having an experience can be more valuable to me to know what to do with the next patient than reading 100 studies. And recently, some of the scientific studies have actually been critiqued and found to be inaccurate, where the statistics have not been correlated with the conclusion. The conclusion was was predicted by the authors, and they try to fit the data to fit